like to take a minute and talk to you about spinal health. Get the relationship between spine and nerves clearly understood so that you can see the relationship as an important part of why you should have your spine checked. So let's take a look at the spine. I'll give you an example. With this plastic model, you can just get a sense of it. As I was mentioning here, where there's a headache zone, misalignments here tend to go up into the head. Problems as you go down into the neck area, problems can be, well, first of all, you'll have neck pain. And with that, you can affect the nerves that are leaving the neck, so problems with the throat. And then, of course, the nerves that leave the neck go into your arms. So when people have advancing conditions of degenerative spondylosis, for example, then the neck, having become a chronic condition, starts to affect the nerves in a regular way. And guess what people complain about? They complain about numbness in the arms. Pain and numbness in the arms can go all the way down to the wrist and just go part way down the arm. Depends on how many nerve fibers are being pressed here in the spine. So the neck condition, where people normally complain about some local pain, stiffness, as a matter of fact, is actually another sign of neck problems, because stiffness is a low-level pain. If you have no symptoms at all, then your neck is fine. But if there's stiffness or mild pain or moderate pain or severe pain, these are obviously signs that the neck is not right. So the individual bones in your spine, they can swell. The joints where the bones fit together, these joints can swell. The ligaments can swell, the muscles can get tight, the nerves can swell. So over time, there are a number of different problems that develop in the spine that can cause pain and discomfort and radiating pain away from that. So if we take a minute and look at the other parts of the spine as we go down, the thoracic area, where the nerves that leave in the upper part of your spine go to the back of the arm and shoulder. They also go to your throat. So commonly when parents bring me their children, they've been suffering of asthma, this is where I find the problem, because the nerves that leave the back of the spine there go here in the throat area. So the nerves, of course, leave here, go to your heart, your lungs, your stomach, as you go down, right? It goes to different organs as you go down. And of course, they go to muscles, shoulder blades. So people will experience either dull, achy pain, or they can have sharp stabbing pain. And so depending on how that presents itself, the question is, how did that get there? Usually a fall or an injury. Sometimes it's not that noticeable. Sometimes it's a gradual problem that developed. And as a result of poor posture, small repetitive activities, the spine loses its integrity and it starts to show weaknesses, and at one level or another, the problem develops. So if we go further down into the spine, down to the lumbar area, here there's no ribs attached, whereas in the middle area, all of your 12 ribs attach. So if a rib gets affected because of a misalignment, that pain could run all the way around. Sometimes people have pain in the chest and they go get the emergency room and they get a ECG, and then the test comes back normal. There's nothing wrong with them, but in reality, because it was never a heart problem, that was just trying to find the cause of it. People don't know to go to chiropractors. So we end up in hospitals trying to get some answers when a chiropractor would have simply been able to correct that. As we look into the lower part of your spine, this is a very common area for people to have back pain. As a matter of fact, as you go down, the more weight of your body sits on the different joints. So a person can have a neck problem, but they'll experience stiffness. A person will have a low back problem, and they will experience pain, because there's just simply more weight being put on pain-sensitive fibers that will result in localized pain. And when we check people out, we notice that as much as you try to feel your back pain, you're going to find that it's general, I can't put my finger on it kind of a thing. But when we check with our special skills and look at where the misalignment is, we're going to find that we can put our finger on the spot, and it's going to be sore because it's typically a joint. The muscles may be affected, but literally it's the joint that's responsible in most cases. So again, in the lumbar spine, the nerves can be affected. These nerves can go down your legs. So we call that sciatica. And then the nerves that leave here that don't cause pain go into your abdomen. So these nerves can affect your colon, they can affect your bladder, they can affect your female glands. So the result is we have problems that we might not think are related to the spine. Now, what are some of the questions that you would have regarding chiropractic? Well, I would suggest that there's a place you can get some answers. I am a wellness author. So So you can go to my website, which allows you to interchange ideas and questions with me. It's called Doc Mike Blog. So DOC Doc Mike, M-I-K-E, blog.com. And you can go there and read the existing articles that have been published on wellness. Talks about all the typical conditions that my patients share with me, the concerns that they have, and I write up a simple explanation about that particular topic. But if any of these subjects doesn't cover your particular interest, please don't hesitate to send me a note. There's a place for you to ask Doc Mike, and I'll be able to review that and give you an answer in person, by email, or you're welcome to come to the office, we can discuss it, or I'll make it another blog and I'll share it with everyone else because I haven't covered that topic yet.